Pain in your limbs, numbness, and weakness. Neuropathy is a common condition that can cause chronic pain. If you're searching for a solution, the team from 360 Medical Wellness and Neurology wants to help you feel better from head to toe. Doctors Jimmy and James Ninh are here to tell us about their breakthrough medical protocol for neuropathy. It's nice to have y'all here.
Thank you for having us, Taylor.
Let's begin a bit by who y'all are and what is neuropathy.
So I'm Dr. Jimmy Ninh, I'm a neurologist, and this is my brother, Dr. James Ninh. He's a chiropractor. And what we do is we treat neuropathy, and we've been doing this for 30 plus years between the two of us.
And so tell us a bit about what neuropathy is.
Well, neuropathy is kind of a short circuit in the electrical system of your home. When you have neuropathy, the electrical wires of your body don't work, it short circuits, the lights go on in the house, and things just go haywire. And that's kind of in a nutshell what neuropathy is.
So it's not something you want, and
Absolutely
you guys
not.
have a way to fix that. How are y'all different?
Well, you know, the traditional medication with gabapentin or Lyrica is usually prescribed for neuropathy. And because of the short circuit, the medication doesn't know only to go to the limbs or only to the feet. It pretty much goes everywhere, so it affects everything. You typically don't see results immediately, and it usually takes a very, very long time. And the side effects are just much greater than the actual symptoms of neuropathy itself.
Yeah, and you know, I have to say, as a physician, you know what's the most frustrating thing about treating neuropathy? It's that sometimes the medications, they cause side effects which are worse than the actual symptoms of neuropathy. And as a physician, your primary goal is to heal a patient, and when you can't do that, it just really is frustrating. It's frustrating for us, it's frustrating for the patient, to the point, one day I woke up and said, why did I become a neurologist? I can't even help patients. And that was, in that moment when I got so frustrated, I had to, rekindle my love for medicine, that I decided, my brother and I decided, hey, we're going to do something. So we created a new program to get better results than we were getting from traditional treatments using Lyrica and gabapentin.
So what does that program look like, and who's a good candidate?
Well, the single most important thing that our program is different than traditional medication is if you follow everything that we ask you to do and we have their compliance, you actually start seeing results almost immediately.
Wow.
You just don't get that with medication or any other types of therapy. And so our program is not only designed to give you the relief immediately, but to also prevent it from coming back.
Yeah.
So while we are able to stop the pain almost like a light switch, we want to help promote blood flow. We want to stimulate these nerves. We want you to become more active, and by doing that, not only to stop the pain, but the pain's not going to return.
Yeah. And at the end of the day, the goal is quality of life for the patient.
Yeah.
That was what was frustrating before, is we couldn't help patients. They would get depressed from their pain. Now we have a way to help them get pain relief and just improve their quality of life so they can do what they normally would like to do.
Yeah, and so it sounds like you've affected a lot of people's lives. Can you share one of those stories with us?
Oh, Taylor, there's been so many, but I can tell you one patient that has really hit us close to our heart is Miss Norma. She's actually from Corpus Christi, and she actually drove 4 hours almost every day to go through with our program. And Ms. Norma was somebody that had the burning pain, the tingling, the sensitivity, her loss of balance. That's very common in a lot of patients who experience neuropathy. She has gotten tremendous results, and to see her life completely turn around has been amazing.
Yeah, that's really great to hear. So if people want to find you or find more information, what's the best way to do that?
Well, Taylor, neuropathy is so frustrating, and we just want to go out and let everybody know about it. People just don't know about neuropathy, that there is actually something that can be done about it.
Yeah.
So we've opened up some time slots where we can actually sit down with the patient one-on-one and go over the specific symptoms and see if they are indeed a good candidate. So we're offering 25 free screenings for patients, for our CBS Austin viewers, to see if they're a good candidate for our program. If they are a candidate for our program, I can assure you that they will see some immediate results.
That's great news. Thank both of you for being
for
here.
IVneuropathy.com.
Check it out and take advantage of those free screenings. We appreciate what y'all do. We'll see you soon.
Thank you.